Anu, welcome to our show first.
Thank you, Sanjiv. It's a pleasure to be on the show.
So, Anu, I will go straight to the questions because people are really, really worried. And it's not the question of just India, it's a question of the whole globe. We have the countries like Thailand, less than 1% vaccination. And we have countries where they have 70% vaccination and still they are worried because they don't see herd immunity. We have countries like Australia where very few people want to take vaccination. So we are, as a human, we are all baffled. Where are we going and what is the second wave? So can you talk a little bit about that?
Sure. So I think, we have to look back at history. And I think if we go back to the first pandemic that was there, which was in 1918, I think there were multiple waves in that as well. I think we just chose to forget it in the beginning. Maybe that was the problem. The second thing is, of course, I think it was probably the first time in our lives that we had to face something like this. So I think after a certain point, there was a fatigue that set in people. So they stopped doing what was expected of them to do, which was to do social distancing and others. And I think, so there were multiple reasons. One is that people forgot what was expected of them in the case of a pandemic, and they saw the cases going down. They thought it was all getting
party
over.
Time.
Correct. I think
everybody's
a lot of
in Florida beaches.
So a lot of
nothing against Florida.
Everything, people getting together in thousands and in some cases lakhs. That was one problem. The other problem was also that when you look at any virus, you will find that they will mutate, right? And this is a normal course of how all of these replicate.
So Anu, when you talk about it mutate, so is it normal for even our the vaccines and we take every year for seasonal allergies? Is it different than that, or is it the same nature?
No, it's a similar thing, right? If you take any virus, or you take even us as human beings, we also mutate, right? These are normal course of things. Because if you think about it in very simple terms, it's like saying that you have a set of sequences or set of, like a proteins that are there, and these are multiplying in our body. And when they multiply in our body, there are some copying errors that we call them. And those copying errors are what would be a mutation, right? So for instance, I think last time when we discussed about how one small difference between you and me might cause a slight difference in terms of how we look at or how, certain things. Similarly, I think when you look at a virus, when it goes into the body, it starts multiplying, right? So it goes into our immune system, it starts multiplying very rapidly. And in that process, I think there are some changes. Now, what has happened is that because this has been around for a long time, I think what we have started to see is that there are many variants many mutations that have occurred. And because of these different mutations that have occurred, some of them will change the way the virus behaves, right? And I think that's what has happened right now. I think there are some where we are seeing that there are certain mutations on what we call as the place where the receptor gets into the cell. And I think those are the ones that are of concern. And I think that's what we are seeing. So I think once you sequence any or all of these genomes, if you had done all of them, we would have a much better understanding. But let's assume that right now we are looking at about a percentage of genomes, or probably less than what has been done. What we can find is that the interesting part is that we can actually trace it back to where it came from and how you are evolving, right? Just like you look at the human mutation.
True.
So I think that's what you are seeing right now. Of course, I think there's a lot of confusion because people start calling double mutation, triple mutation, and all of that. I think there are many more than double or triple mutations. There are many more mutations that are there. I think what you have to look at is the mutations that might cause a change in terms of transmissibility of the virus, or in terms of whether it'll cause a more severe disease, right? So those are the things that we should be concerned about. But what has happened, I think, has been a combination of factors. One, which we mentioned, behavior. Two is that there are now a cocktail of variants that have come in, right? Because obviously, even though a lot of countries have stopped.
So Anu, let's talk a little bit about the cocktail, right? So we saw this virus 18 months ago. It started from north of Asia. I'll prefer not to name the country. That's the origin. And then it traveled all over the world. In fact, I was on the ship in January, and that same ship in Fab was on the water for a month because nobody let them dock. It's just a bizarre situation. Then we did the lockdown in America. We saw the situation, what happened in America. Then UK was okay, and all of a sudden UK, and we start calling it UK variant, right? And then now it become India variant. So I'm really confused. What does this variant mean, and how the country get associated? Because there is no country adding something to it. It's not like, oh, I putting US variant and I'm putting Indian variant and I'm putting African variant. And you talked about it. Just one change makes us black or white when it comes terms of the genetic difference. So how this variant get created? That's my question. And what can we do as a community to stop this, or at least mitigate it? Because I know we can't stop it completely, but can we mitigate it? Can we reduce it?
So I think one mutation, I was not saying one mutation can make us black or white, but I mean, basically what I meant is that, a SNP can cause a change in a lot of things. Now, when you look at how these variants are named, and I think a lot of people will get horribly confused, but there are actually 2-3 systems existing, and I think now the WHO is coming up with a third system. But the ones that you're hearing most often are the B1617. Then you hear about the B1, the one in the US which is called B11.7. Then there is one more from South Africa and all. So the way they decided to name this was simple. So they said, where it started from, so A and B, and then they said, if it goes beyond, the next ones will be called C, if it is very different. So it's similar to, if you think about it, like your software updates, right? You have a system, you start off with version 1 and you have version 2 and so on. So it's similar to that, right? In some strange form. So you have now, when you say B1, it's the first one that you saw, and then 0.1, and then when you see B.1.617, it's the 617th time they've seen that variation from the same set of ancestors, right? So that's what is there. Now that doesn't mean it is only that 617 variations in that. What it means is that this is the different type of thing that you have seen amongst the type of mutations that you have seen.
So what I'm hearing from you is these are the mutations happening, and these will continue to mutate. I had 2 major doctors from US. We talk about the same issues. So now when we talk about treating these variants and then the vaccinations, so what I'm assuming is even vaccination has to catch up, because every time it's continued to mutate, we have to continue to go and check if this variant can be handled with this vaccination. Am I right?
Correct. But so far, luckily, most of the vaccines that we are seeing and most of the variants we have seen so far have been all right in terms of, how vaccines are reacting to it. But I think all the vaccine manufacturers are working on making, sure that, any new variants
will continue to catch up,
right? Now, so in the B1617, I think, which is the one that we are talking about, that was found a lot within when we sequence, we found quite a lot of it. Now, this has some that we found in previous ones, whether it was in the US or some of the mutations that we found in South Africa as well. And I think the reason why it became so popular is that it had 2 mutations of concern on the receptor binding domain, and that's why that was there. In total, it has more than 15 mutations, right? So that's the thing, that these are not necessarily, it is simplified a lot by the media so that people can understand and can easily talk about it, right? But I think if you talk to anyone who's from the virology department, I think they will tell you how these are named and what is actually happening. So these are basically, you're trying to, everything ultimately links back to the same sort of thing. And then you start seeing that there are some mutations that are occurring. And whenever there is significant enough thing, like I mentioned in a software update, it will be called a different version number or a different thing, right? So it's like that. Now, from what I understood, the 2 vaccines that are currently approved, actually now 3, are all effective against the variations that we are currently finding right now. But you never know, this might continue to, given that there are a large number of cases, it's possible that we will see even more variations as we go along. So vaccination, I think, is effective when you do it very quickly for a large number of people. And I think that's where I think we have a big challenge right now, because we haven't vaccinated a large number of people. So that's where.
And less than 10% of the world is vaccinated today, which is very low rate based on what I know and the data I'm reading up. I hope I am incorrect, because if it is more, it's better for us. I understand that. And there are a lot of people who are against vaccination, and I will let them, because people have freedom of choice. But at the same time, we have to talk about Good Samaritan. Okay, you are not going to get sick, or you will be able to handle it because you are younger, you have the immunity. How about the people who can't handle it? So, but let's go forward. Now, the challenge I am seeing it was this new mutation. Last year we were talking about ventilators only. Today it become the need of oxygen concentrator. And tomorrow I'm maybe something else, the third variant. I'm not sure what's happening, but one common theme I'm hearing and common challenge I'm hearing, in fact, two of my friends' parents passed away yesterday. It's just really a sad situation, personally for me even. They were getting better, and then they have the cardiac arrest, and they just passed away immediately. So what is really going on with the second variant? Is it there is no time people get, and these different drugs from major companies, these injections are being sold, are these effective? Can you talk a little bit about that?
Sure. I'm not a doctor, but I can tell you what some of my doctor
You have the most data.
Yeah, what my doctor friends are telling us, right? So one problem is right now, there is clearly, I think there are too many people infected at the same time, which basically means that a lot of people looking at the need. So if lots of people suddenly need oxygen, then you will run into shortages, right? That's exactly what has happened right now. The second is also panic. I think it came so suddenly, this new wave that came in. I think that has also created panic. And that panic basically has created a very strange this thing where people are giving all kinds of drugs to patients, which you don't need to give. So I think that's another big problem that we are seeing right now, because one is that we never saw children being affected in the first right? I mean, even if they were, it's not that they never were, but it was very light, right? Now what has happened is...
Anu, one thing is clear, that we were not seeing the problem of cardiac arrest earlier. Now people are dying of the heart attack. So that's one problem, and it happens so sudden that we are not able to treat that, because now we are treating them very differently. So that's one problem I'm seeing constantly. And there is a new thing called black fungus. Can you talk a little bit about this black fungus? What is the challenge? And as a community, especially our United Against COVID initiative, which is all the alumni have joined hands together, we wanted to be prepared. We are sending a lot of oxygen concentrator. We have already sent it, and we are working really hard, closely with every single association and organization. I'm appealing all of our audience to go and register for United Against COVID.live. Our event will be live Saturday morning. Anu will be there to tell us a little bit more about what's happening on the ground. I'm really going to ask you to be provide us really precise information on the ground. How can we help? So black fungus, I'm hearing a lot. Some of my friends even ask me and ask the organization to arrange funds so we can send medicines for that. They think that is going to be another biggest challenge. Is it true? First of all,
actually, black fungus, according to a lot of the pulmonologists, are actually saying that we are giving them unnecessary medication, especially steroids. Right? So that is one of the big problems that we are finding, that people are, that's exactly where I was getting to. That one, when people see high fever and all in children and also in young adults, I think they feel that by quickly giving them medicine, they will treat them. But if you do it very quickly on in the disease, what you are doing essentially is you are suppressing the immune system. And some of those can increase. So especially if you are, it increases some of your sugar levels, it reduces your immunity and a lot of other things. It's very interesting. I've been seeing some of the medications that a lot of doctors are writing, and some of them are basically saying you take everything, right? And I think, and when people see
it's some like a cocktail, you mix 5 kinds of alcohol and you drink it, you are going to...
Exactly. So it is not very, it's not very effective, but people are giving, right? Because when you come to that point where you're seeing somebody struggle, you want to try everything to make that happen for them. So I think one is that the medicines that are being used prescribed left, right, and center in many cases.
It's overly used, basically.
Yes. So one is that it has just been given all kinds of this thing that causes a problem. and especially so if people already have had diabetes and other things. I think it causes more challenges in patients like that, right? So I think one is that we have to be very careful about how these are treated, because it can also come from bad some oxygen supplies as well. So I think one is that make sure that they're sterile, but also make sure that
Let's just stay on this question now.
But again, I'm not the doctor, but that's what we are hearing from everybody, that I think more than anything else, people are getting too scared and panicked, and I think making the situation worse.
I completely agree with you. Anxiety is definitely, and if we are anxious, our oxygen level goes down automatically. I mean, we have shallow breathing. That's very, very common. I do understand, but the other problem we are seeing it is, since some people are saying, "Oh no, it's okay, I'll be better," and all of a sudden they just get into a situation and then they're pretty much dead because they have a heart attack. So we don't know where to draw the line. Since black fungus seems like a real problem, seems like an issue, why aren't the organizations like in US or India and the big, we have like Surgeon General Vivek Murthy here and all, they are not coming up with these guidelines how to treat these kind of patients. Is it so complex that each patient is very unique, just the way you do the genome analysis, or it's hard to provide that information to doctors or physicians globally?
I think I saw some guidelines that were published by ICMR not long ago, but it does publish. So I think it's not that guidelines are not there, but are those guidelines reaching every doctor and every patient?
So you are saying ICMR has published good guidelines for physicians, doctors, and patients to follow, and if they follow that, possibility that we reduce this calamity to some point, we may not be able to completely eliminate it, but we'll be able to reduce it. Where can our audience find these guidelines so they can share this with their loved ones?
I think it's there on the ICMR website. And also, I think a lot of the pulmonologists also created an India COVID SOS website. And I think that has some fantastic place.
They're doing good work. This is Silicon Valley based people that involved. We are also working with them. Great organization.
So there are some very good, organizations and a lot of great information. But the problem is to separate the right information from the wrong. And sometimes it becomes very hard when some people already have some, pre-existing ideas about how.
So there are a lot of variables. We both know that, but these are guidelines only. So Anu, we are almost to the end of our segment. What advice do you give to our audience? Most of our audience are in Silicon Valley or in United States. What can we do and how can we help our nation? You are on the ground, you are testing thousands of these patients' data every single day. I'm pretty sure you are finding some very interesting data point which can be leveraged so we can do something. We are all engineers, we want to solve problems. That's one problem we have is we have to solve the problem. And we can't just sit quiet at this time.
So I think obviously, I think a lot of people are making efforts to add oxygen concentrators and oxygen capacity. That is a great thing. The second part also is that I think, we need more sequencing of the genome on a global level. And I think that helps us to understand, especially how to control if there is a future wave as well. Because I think the world, however much you may try to control it, ultimately will not be limited by borders, and therefore even though we might limit it, I think the virus is not, and therefore I think individually we might be able to take precautions, but we have to take it as a community, as a global community, because I think a lot of people that we know, and especially I think people who are in Silicon Valley who are looking at their parents and all must be giving them advice not to go out, but they might still get infected, because at some point, I think it is, it might come through many different channels, whether it's airborne.
It's airborne, so that's very hard.
So it's hard to keep, I think, even though you can keep away, I think the problem is how to change behavior of 1.2 billion people. I think it's not easy to do.
No, we are talking about 7.3 billion people. I know, don't say it is a 1.2 billion problem, because the problem is of 7.3 billion. I mean, we are not hearing the news from a lot of different countries because they're somehow managing it, but we know the reality. I mean, it's not entirely true that it is a 1.3 billion people problem. So See, Anu, the challenge is this is going, and you talk about we need to collect and collate more data. How do we do that? How do you propose we can help?
So I don't know if there is a global organization that can to create like a large global fund to be able to do something like that for a certain percentage across the globe. So for instance, I think the UK is probably the only country that does very large amounts of sequencing.
Because the US they have all public healthcare systems, it's a little easier for them.
Correct. Even the US, even though they have done a significant, it's still not very large. It's about 2% of all the cases. So I think, and some countries I think don't do it at all, right? So it becomes hard to keep, to understand some of this across the globe, because once it's gone, it's gone. So you won't be able to figure out what is going on with that. So I think if we need to understand, exactly what is happening with this virus, I think it's important to be able to do that at a global scale. I don't know how that works, because currently, obviously, every country has its own way of doing things. And I don't know how the cooperation
we can do that.
There are common websites like GSAID and others that are already collating that data.
So let's bring that conversation for, let's keep it for Saturday. We'll talk more about it, because we will have the right forum for that. For now, our audience, I can say that yes, California state is changing the mandate around mask. Our strong request and recommendation based on the conversation I have, please take precaution, please wear mask if you can, at least when you go outside, maintain social distance, and please make sure your friends, family members in India don't feel anxious, panic. We are doing everything in our power. Organization like Mapmygenome, Anu heads it. They are doing a lot of great work. We have collated a lot of data. We are partnering with several people. We'll solve this problem. We will fix it. We are here. We want to help. Please join us for this conversation on Saturday, and we'll talk some more. Anu, thank you very much for your time. And if our audience wants to reach you, how can they reach you?
I'm easy to reach on email, but I'm also available on Twitter and all other social platforms as well.
Thank you very much, Anu, for your time. Really appreciate it.